With another installment in our continuing series of reports, the price you pay, those hidden costs in everyday life that are taking a toll on so many American families. Tonight, our focus specifically is on health care, and we have an update on a story we first brought you last month. The first time around, it provoked a huge reaction from a lot of our viewers. It's about the words that appear on hospital forms, and small differences in the fine print could mean thousands of dollars in payments down the line. We get our follow-up report tonight from our national correspondent, Kate Snow.
Brenda Kelly-Nellam was driving her husband Doc to an appointment when he started having symptoms of a stroke. At the hospital, doctors told them they were putting him under observation.
I was really frightened at what's wrong with my husband, and then they came up with this observation status, and I questioned why.
Brenda is an advocate for seniors in Virginia, so she'd heard that term, observation status, before and thought it might be trouble. And then a nurse spoke up.
He said, this could have an impact on what you pay.
The nurse was right.
You've got charges for physical therapy, speech therapy, medical care.
The total is $22,170.
And here's the thing, Medicare pays for rehab only for people admitted to a hospital as inpatients for 3 or more days, not if they were classified as observation status.
Whoa.
It's what happened to MJ Bracu, under observation with a broken leg and now saddled with a $28,000 rehab bill.
The whole thing is so outrageous, and it's not right.
This is not something you learn in medical school. And it's really an administrative, arbitrary decision.
Dr. Ashish Jha of Harvard School of Public Health says there are times when it makes sense to label a patient under observation, when someone's having chest pain, for example. But most of the time, he says, it's not a medical decision, it's a financial one.
Administrators who have to manage billing issues, they're the ones who end up teaching doctors when to try to use observation status.
Wait, the people that are in charge of billing?
Yes.
Are doctors feeling under pressure?
Yes. So I think there's very clear pressure on doctors from the hospital to make determinations in a certain way so they will get paid for that hospital care.
And patients get caught in the middle.
I think it's a very complex, administrative rule that Medicare has put together. I think it's deeply unfair to patients to have to sort all this out.
If it happens to you, experts say ask if you're under observation and if you'll need rehab. If so, argue and be persistent. Like Brenda, she asked so many questions, the hospital finally relented. The doctor changed Doc's status to inpatient. His $22,000 rehab bill was covered.
If my husband had been there by himself, he would have accepted the observation status.
What would that mean to you if you had had to pay that?
Oh, my goodness, it would have been terrible.
Experts say you should fight for a status change in the hospital because Medicare appeals later on, Brian, can take years.
As we've seen, a lot of nice people getting caught up in this innocently. Kate Snow with our follow-up report tonight. Thanks.